Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cluster headache. What are the characteristics of cluster headache? These are comparatively common headache. There are attacks of unilateral, severe, non-throbbing headache with pain over the orbital and periorbital regions, lasting for 15 minutes to 3 hours, occurring in clusters, commonly occurs at night, once every other day to 8 times a day, with days of remission for months to years. And the pain may happen in the same place in clusters. Cluster headaches are associated with conjunctival injection. You'll get redness here, nasal congestion and rhinorrhea, watering from the nose. There is the lacrimal fluid that is going through the inferior meatus of the nose and coming out as the rhinorrhea. Burning sensation over the nose on the lateral aspect of the nose. Suppose this side has Horner's, this side has cluster headache area. We will get the burning sensation on one side of the nose. Feeling pressure behind the eye, agitation, patient will be very much agitated. Horner syndrome. So this side has Horner syndrome, like that of the ptosis and the pupillary constriction or miosis. Okay, so these two are important component of the Horner syndrome. Horner syndrome has other features like that of anhidrosis or enophthalmos. We are finding here ptosis and miosis. Cluster headache, mean age of onset is 25 years. So its onset is little later than that of the migraine headache, more frequent in men than in women. How much frequency? Man has 5 times more possibility of getting cluster headache than that of the women. Cluster headache is of hypothalamic origin with rare family history. It is of hypothalamic origin, so during cluster headache, if we do an MRI, we'll see changes in the hypothalamic gray matter. Okay, it may be an autosomal dominant condition. In around 5% cases, it may run in the families, but mostly it is hypothalamic origin, not a hereditary disease. Episode is precipitated by alcohol consumption, tobacco, histamine or histamine-rich food like that of the tuna fish in the can, exercise, intake of vasodilator drug, they will aggravate cluster headache. Treatment should be done by the registered physician, licensed physician. What is done? The most important point of treatment is to avoid getting cluster headache by avoiding precipitating factor. What are the precipitating factors? These are the alcohol, tobacco, histamine, exercise, intake of vasodilator drugs, like that of nitroglycerin. Okay, so one is the avoidance of precipitating factor, then abortive treatment, 100% oxygen by face mask, 100% oxygen by face mask. And we have also for abortive treatment, we have the sumatriptan, or you can use the NSAID. Prophylaxis of cluster headache by valproic acid. Valproic acid is also an anti-epileptic drug, but it also works in cluster headache as a prophylaxis agent. Lithium, we must know the adverse effects of lithium, like it may cause hypothyroidism. Ergotamine, methysergide. So these are the prophylactic treatment, and these are the treatment. Okay. And that's all about the cluster headache. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.